am checking my orders, I am gathering my equipment, I am providing privacy, and I am performing hand hygiene. Hello, my name is Samantha. I'm going to be your student nurse today. May I please check your ID bin to confirm your name and your date of birth?
Yeah, it's Isabella Moore, 92904.
Okay, perfect. That checks out. Do you have any allergies?
No, I do not.
All right, perfect. So today we're going to be performing a genital, urinary, and a reproduction system check-off. Are you familiar with that procedure?
Yeah, I am.
All right, perfect. Are you experiencing any current concerns, any diseases or disorders with your genital, urinary, or your reproductive tract?
No, I'm not.
No? Okay, perfect. All right. My patient is in a supine position while I'm going to be continuing this procedure. I'm just going to ask you a couple questions about your voiding, urination, peeing, whatever you would like to say. Are you experiencing any burning when you pee, any urgency or frequency, any incontinence, any polyuria, hematuria, nocturia, dysuria, any pain, anything of that sort?
No, I'm not.
No. And when is the last time that you peed?
I'd say probably like this morning.
Okay, and can you please describe the color, odor, and frequency of your pee?
It was yellow, there was no odor, and I usually go to the bathroom like 4 to 5 times a day.
All right, perfect. Okay, now I'm going to just inspect your lower abdomen, and I'm going to palpate your bladder. My patient's already in a supine position. The bed is raised at working height. My hands are washed. I'm going to be just putting on some clean gloves while I palpate. All right, are you experiencing any pain or discomfort at the current moment?
No, I'm not. I'm good.
Okay. All right, I am inspecting the lower abdomen for any distension, which I'm not noting. And now I'm going to be palpating the bladder. Okay, palpating the bladder. No distension, no any discomfort or pain?
No, I'm all right.
All right, and no rigidity, which is perfect. Okay, I'm going to cover you back up, and that concedes our portion of the GU. I'm going to dispose of my equipment really quickly, but I put that up for patient safety. All right, so now we're going to be discussing the reproductive. How often do you perform self-exams on your genitals?
Usually like once a month.
Right, perfect. And are you currently sexually active? Do you have any sexual partners?
Yes.
Are you at risk for any STIs? Do you use any protection?
Yeah, I do.
You use protection, okay, so you have protection against STIs, and do you use any form of birth control?
Yes, I do.
You use form of birth control? Okay, perfect. So, all right, so now we're going to go into the male and the female. So if you were a male, I would ask you if you were having any issues with erectile dysfunction. But if you were a female, I would ask if you have any menopausal symptoms.
I do not.
Symptoms. I would ask how many pregnancies you've had, and is there a possibility you could be pregnant currently?
I've had no pregnancies, and there's no possibility for me to be pregnant.
Okay, and then third, I would be asking you about your menstrual cycle. So what is the length of your menstrual cycle?
It's usually about 5 days.
When has been your last period?
My last period was probably like 2 weeks ago.
And how long do your periods usually last?
About 5 days.
5 days, and then the frequency of your periods?
Usually once a month.
And then what is the flow of your periods?
It's pretty moderate.
Okay, and then I would go into inspecting the genitals. For the sake of the video, I'm not going to be doing it, but for the male and the female, I would be inspecting any lumps on the breasts or the testicles, any abnormalities and lesions on the genitals, any foul smell, any bad odor coming from the discharge, and any inflammation, swelling, itching, burning, anything to do with the genitals.
I'm not experiencing any of those.
No? Okay, perfect. All right, well, I think that concedes my procedure. Are you comfortable? Is there anything else that I can do for you?
No, I'm comfortable. There's nothing else you could do.
All right, perfect. Since my patient is still in a supine position, I'm going to lower my patient. My patient has their call bell within reach and their personal belongings in reach. My patient is comfortable. No further questions are needed to be asked, so therefore I would be washing my hands. I already disposed my equipment, and I would document my findings.